Hello and welcome. You're watching our show, Health and Wellness, Myths and Facts. Now, endocrine glands produce and secrete hormones that are responsible for many important bodily functions. They play a crucial role in whether or not you develop diabetes, thyroid disease, growth disorders, sexual dysfunctions, and a whole host of other hormone-related disorders. Now, thyroid hormones also play a key role in a number of body systems. But how much do we actually know about this gland that bears such enormous responsibility for our continued good health? Well, thyroid disorders are among the most common of all endocrine disorders in India. A third of thyroid patients in India are unaware of their condition. This disorder also affects people of all ages. Now, thyroid disease is a silent disease whose symptoms are subtle and can often be overlooked during diagnosis, and timely diagnosis and comprehensive treatment with the right medicines can ensure a successful outcome. Well, January is also Thyroid Awareness Month, and it's perhaps more important than ever before to talk about thyroid disorders. Our experts will provide medically accurate and actionable advice to prevent the development of thyroid disease and guide our viewers with effective long-term strategies. We're being joined today by an elite panel: Dr. Sarita Bajaj, President of the Indian Thyroid Society, former Director, Professor and Head, Department of Medicine, MLN Medical College, Prayagraj, is with us. As is Dr. Rakesh Sahay, Professor and Head, Department of Endocrinology at Osmania Medical College, Hyderabad. He's also President of the Endocrine Society of India. Also with us today, Dr. Pramila Kalra, Professor and Head, Department of Endocrinology, Ramaya Medical College and Hospitals, Bengaluru. Thank you, doctors. It's a pleasure indeed to talk with all of you. Dr. Bajaj, if I can begin with you. Of course, we do know that the thyroid gland is part of this intricate network of glands that's called the endocrine system. But what is the exact function of the thyroid gland itself, and what issues can present themselves when a person has a thyroid disorder?
Thank you, Ankita. So the thyroid gland is an important gland. The whole of the endocrine system is an elaborate network of glands and hormones. So thyroid gland produces two hormones that are T4 and T3. 80% of the hormone produced is T4 and 20% is T3. But the active hormone is T3. So in the periphery, that is in the blood, it is T4 that is converted into T3. T4 and T3 are regulated by thyroid stimulating hormone, which is secreted by the master gland in the brain, that is the pituitary. So with the production of T3 and T4, it regulates all the body functions by controlling the metabolism. In other words, the energy the conversion of the food that we take into energy is the main job of the thyroid gland. And all the cells of the body require energy. The main diseases of the thyroid gland are hypothyroidism, that is underactive thyroid, hyperthyroidism, that is an overactive thyroid, thyroid gland enlargement, which we call goiter, thyroid nodules, which can be a single nodule or multiple nodules, and thyroid cancer. Ankita, you've said thyroid diseases are common. Indeed, they are. And they are more common in women, about 5 to 8 times more common. And they run in families as well. So among the risk factors, apart from the family history, if you have any other autoimmune disease, like type 1 diabetes or rheumatoid arthritis, or if you are taking medications which are high in iodine, and iodine is required for producing T4 and T3 by the thyroid gland. Thank you.
All right. Very comprehensive answer there, Dr. Bajaj. Thank you. Let me also just bring in Dr. Sahay at this point to just maybe elaborate on some of the points that you've already touched on. The fact that this is among the most common of all endocrine diseases. Dr. Sahay, Dr. Bajaj mentioned women seem to be at greater risk of thyroid disease as compared to men. Would you agree with that assessment? And why is this the case?
Yeah, so thank you, Ankita. I think as mentioned just now, that thyroid disorders are very common. They are probably second only to diabetes in terms of endocrine disorders. And if you look at the prevalence of, the problems that we have just seen, Dr. Bajaj has enumerated about hypothyroidism. She has talked about hyperthyroidism and nodules. So hypothyroidism is probably the most common form of thyroid dysfunction that we see. And in one study which we had done some time back, we had seen that across 8 cities, we found that it was seen in about 10% of adult patients. So that's the prevalence of that. But when you look at hyperthyroidism, it's probably 1/10 of the prevalence of hypothyroidism. And all these disorders, whether you look at hypo or hyperthyroidism, they are more common in women as compared to men. And probably the ratio is about 8:1 in terms of being more common in women than in men. Probably it's because women require more of these hormones during pregnancy, during menopause. There's a marked shift in the requirements of these medications, and we find that these disorders are more common in women in pregnancy and also at menopause.
Right. Dr. Pramila Kalra, is it mandatory for all women to test thyroid function in pregnancy, and what is the right time to do such a test? What are the usual tests that doctors also prescribe during pregnancy, and why?
Yeah, thanks, Ankita. So, like as Dr. Sahay pointed out, that thyroid disorders are quite common in women, and pregnancy is a state where there are a lot of changes which happen in the thyroid hormone. So the baby, when the baby is developing, especially in the first trimester, in the first 12 weeks, the baby is totally dependent on the mother's thyroid hormone supply. And for the growth of the baby, for the brain development of the baby, the mother's thyroid hormone level should be adequate. So what happens if women have borderline thyroid dysfunction also? It manifests during pregnancy, because the baby also requires the thyroid hormones from the mother. So the borderline thyroid dysfunction will be very, very prominent in pregnancy. As a result of which, what is recommended is that as soon as the woman is diagnosed to be pregnant and she goes for her first antenatal visit or the visit to the doctor, it is advisable that she will do, or she is asked to do, her thyroid function test. Most of the times, the test which we do during pregnancy, basic tests are thyroid stimulating hormone, that is TSH. We also recommend doing a total T4 or a free T4 during pregnancy. We have different cutoffs for total T4 during pregnancy, because pregnancy is a state, as I said, there is a baby inside. There are a lot of hormonal changes which happen. So the thyroid hormone levels also change during pregnancy. So we have to take those requisite cutoffs. Also, if a woman has a borderline thyroid value, which is diagnosed by doing the TSH or the total T4 or the free T4 test, then we recommend one antibody test also, which is called as anti-TPO. Other tests like a thyroid ultrasound or other things are recommended after these reports and if needed for the woman. So once these thyroid tests are done, then the woman is followed up. So if a woman already had thyroid dysfunction prior to conceiving, then she may need repeat of these tests every 3 to 4 weeks during her entire pregnancy, and later maybe in the third trimester, second trimester, at least 6 weeks. But if a woman has not had thyroid disorder and she is normal, then we don't need to repeat the test every time, but we might need to do as and when needed, as advised by her doctor, or maybe once in every trimester.
Dr. Bajaj, if I can bring you back, you talked about hypothyroidism, which is the condition where there is an underactive thyroid gland. But, what are its causes? What are its symptoms? How would one be aware at all if one has a hypothyroidism condition? And, what are the red flags, so to speak, when one should get tested?
Thank you, Ankita. Hypothyroidism, even Rakesh said, is the most common thyroid disorder affecting 1 in 10 adults. It can occur at any age, even at birth, of course, childhood, adolescence, adults, elderly. All through the lifespan, it can occur in any individual at any point in time. I wish I could say, look, if you have this symptom, you go in for a thyroid test and you will be diagnosed. But it is very subtle. Quite often, it is a constellation of clinical features or symptoms that help us decide whether one has hypothyroidism. So, in hypothyroidism, like you said, the gland is underactive. It is producing less hormone. I referred to metabolism. So, your metabolism will slow down. Everything is slow. So, your heart rate is slow. You feel tired, lethargic, depressed. You feel more cold, that is difficulty in tolerating the cold, constipation, muscle aches and pains, joint aches and pains, menstrual irregularities, usually heavy cycles, but it can be the other way around as well. There can be fertility issues and constipation. So weight gain, a little bit of weight gain as well, more of swelling and facial puffiness as well.
Right.
Now, the causes for hypothyroidism are, number one, autoimmune, in which the body attacks its own thyroid tissue or thyroid cells, and majorly it is what we call Hashimoto's thyroiditis. The other reason could be a partial or complete surgery of the thyroid, or having been administered radioactive iodine, which is a treatment for hyperthyroidism. And certain medications may also be responsible. To make a diagnosis of hypothyroidism, TSH alone should suffice. But if we combine it with a T4, that will help us differentiate between subclinical and overt. In subclinical, if we also do a T3 and a T4, the T3 and T4 will be normal, but the TSH will be higher. But in overt hypothyroidism, the T3 and T4 will be low and the TSH will be significantly high. That is how we differentiate. The treatment for hypothyroidism is usually lifelong. It's a simple drug, which is thyroxine. It should ideally be prescribed by an endocrinologist or a specialist who is dealing with thyroid disorders. And fine tuning is important to keep the patient in normal thyroid condition, or what we call euthyroidism. So the patient is not hypo or hyper. So frequent monitoring of TSH as advised by the healthcare professional is important to keep the thyroid balanced. Thank you.
Thank you very much, Dr. Bajaj. Dr. Sahay, what are the common thyroid problems that are seen in babies and children, and could thyroid disease affect the physical and mental growth of a child?
Yeah. So as Professor Bajaj has mentioned, that thyroid disorders are very common even in childhood, even during adolescence, and even in babies who are just born. So it is important. I mean, these thyroid disorders are very common at different ages. Hypothyroidism again is the most commonest problem that is seen at different ages. In babies who are just born, what happens is that there could be a scenario where they have a defect in the gland, formation of the gland, and this is what is called as congenital hypothyroidism. So this has been found worldwide to have a prevalence about 1 in 3,000 newborns. But in India, studies have shown that this may be a little more prevalent. This could be as prevalent as 1 in 1,200 or 1 in 1,500. So it is important to test this, because what happens is that at birth, they may, because the maternal thyroid hormones being conveyed to the baby, they may be totally normal at birth. The baby may appear totally normal at birth, but over the course of the next few weeks or few months, they may develop the typical features of hypothyroidism. And it is during this period also that the brain development of the child is happening. The neuronal connections are happening during this period, and for this again the thyroid hormones are very essential. And during this period, if a person is not, I mean the child is not or the infant is not, or the neonate is not identified to have hypothyroidism, they may not be getting the thyroid hormones which are required for the adequate brain development, and they may end up being mentally retarded. So this is an important cause of, a reversible cause of mental retardation, and hence it is important that we screen all children at birth to pick up any thyroid dysfunction that may be present and treat it accordingly. So treatment is very simple, but identifying that is very important, and hence there is need for universal screening. Now coming to the later ages, that is during infancy, during childhood years, what happens is that the thyroid hormones are very important for the growth of the child, the linear growth of the child. And so if any child is not growing as per the expected rate, then they should be, or if they are shorter than their peers, then they should be evaluated for thyroid function, because at this time they may not have other manifestations. The typical manifestation we just spoke about, the skin dryness, the thin hair, and all the other features that you spoke about may not be present in them. They may just be manifesting with delayed growth. Right. Now, in adolescents, pubertal development is very important. I mean, pubertal development is dependent to a large extent on the presence of thyroid hormones in normal quantities, and this is very important. And any form of delayed puberty can be because of thyroid dysfunction, and all children with a disturbance in puberty should be evaluated for thyroid function.
Right. Thank you so much for that. Dr. Pramila Kalra, what are the thyroid diseases that are then commonly seen in the elderly population, since we've talked about children and babies, and how different is that from how it affects a younger population?
Yeah, Ankita, it's very important, because when we talk about elderly, in children and adults, it is still easier to diagnose because they may manifest the typical symptoms and we may say, yeah, this is attributable to the thyroid problem. But what happens in elderly, because of the aging, many of the symptoms which they manifest are attributed to the aging process or the comorbidities or the other illnesses which they have. So if an older person is fatigued, lethargic, depressed, not responding properly and just lying, not eating properly, it may be thought of as an aging process. But many of these symptoms can be because of the thyroid problem. So as we already discussed, that it can be either the thyroid can be functioning less, or the thyroid can be functioning more, or there may be some thyroid cancers. So all these things can happen in elderly, but these things are more common in elderly because as the age progresses, the incidence of autoimmune thyroid disease, the diseases which happen because of antibody formation against the thyroid increases. Also, the thyroid cancers increase as the age advances, and they can be more aggressive. So first thing is, because there may be not typical symptoms which may manifest in older people, there may be paucity of typical symptoms. We might have to be more suspicious in elderly if they manifest with any thyroid problem, which may be like patient may be lethargic, may have fast heartbeat, may not be responding properly, may have some cognition, mental function decline, may be depressed, may be lying on the bed, not eating properly. All these are signs of thyroid disorders in the elderly. It's not necessary that they have thyroid disorder and then they only manifest this. It could be part of other illnesses as well, but we need to have a strong index of suspicion. Very important in old age is cardiovascular and bone health. So many times the older people may present with palpitations, and that can be a manifestation of overactive thyroid. So that's why it's very, very important that whenever we have an older person who comes to us with any of these symptoms, we get their thyroid function test done. A basic TSH and a total T4 is good enough initially to diagnose. But also we might need to do thyroid ultrasound if we are suspecting some malignancy or cancer, or if they have an enlargement in the neck area. Also, when we are trying to treat the older people for thyroid disorder, especially for the underactive thyroid, that is the thyroid not functioning properly, we have to also see their cardiovascular health and decide on treatment on the basis of their cardiovascular function. Also, when they have over-secretion of the thyroid hormone that we call as overactive thyroid, also we have to see the cardiovascular and bone health, and many a times the cardiovascular problems or the bone issues may be the reason for treatment in such cases. As regards to the thyroid cancer, the treatment is as per the protocol, what we do for thyroid cancers. Thank you.
All right, Dr. Kalra, thank you all very much. We will slip into a quick break, but of course, there's more to talk about when we come back. We'll talk about hyperthyroidism in greater detail and also what causes thyroid swellings. We'll be back in just a moment. Welcome back. January is Thyroid Awareness Month and we're doing a deep dive into thyroid disease today, and we're accompanied by perhaps some of the best known names in dealing with thyroid diseases in the country. Let me take this right back to Dr. Sarita Bajaj at this point. Dr. Bajaj, explain to us exactly what is hyperthyroidism. You touched on it, of course, before in this discussion as well. But if you could just tell us in greater detail about its causes, its symptoms, and just how to treat it.
Yeah, Ankita. So hypo is underactive, hyper is overactive. Thyroid, so the thyroid gland is producing more hormone than it would normally be doing. Again, Dr. Rakesh has already said it is not common as compared to hypothyroidism. It is 10 times less common, but more common in women, and a family history also may be part of help in the diagnosis because it is majorly autoimmune. Amongst the causes, the first and most important cause, again, autoimmune, is what we call Graves' disease, in which the body attacks the own thyroid tissue. The second important cause is a hyperactive gland because of a nodule. It again could be a single nodule or multiple nodules. And the third important cause is thyroiditis. So these are the three causes, and the first one, Graves' disease, is the most important one. Amongst the clinical features, so in hypo, it's all slow. Here, everything speeds up because the metabolic rate increases. So you will have a rapid pulse. Pramila just referred to in the elderly, it could be irregular. It could be irregular at any age, which we call atrial fibrillation, but the elderly may only present with an irregular heartbeat, and that may lead to a diagnosis of hyperthyroidism. You are having you're passing more of motions, your hands tremble or shake, shakiness of the hands, nervousness, irritability. These are some of the common clinical features. Intolerance to heat as opposed to hypothyroidism, in which there was intolerance to cold. Right. And specific features of Graves' disease are an enlarged gland, which we call goiter, and the eyes become prominent. So they seem to be bulging out. So these features help us differentiate the cause clinically. The tests, again, are T3, T4, and TSH to make a diagnosis. So that will just confirm whether one has hyperthyroidism. But if we need to differentiate between the different causes, then we need thyroid antibodies, and sometimes we do an ultrasound of the neck to look at the thyroid, and we also need to do a radioactive iodine uptake. So these are the tests that may be required. Right. Treatment, medications, radioactive iodine, or surgery. Thank you.
All right. Dr. Sahay, is it true that a person can't lose weight if he or she has hypothyroidism or might struggle to lose weight?
Yeah, Ankita, this is a very common misconception that happens, that many people feel that if they are hypothyroid, they probably can't lose weight, and it is because of the fact that we know that hypothyroidism can lead to some amount of weight gain. It's not that all the weight gain that a person who is significantly obese has gained is because of hypothyroidism. It's a few kgs that is gained because of the hypothyroidism, and there's also a disturbance that happens when a person is significantly obese. They may have a rise in their TSH levels, which may be falsely showing a picture of subclinical hypothyroidism, but that may not be truly because of the because of being hypothyroid. So this is something which has to be kept in mind, that just by treating hypothyroidism you cannot expect to lose weight. And similarly, if you are adequately treated for hypothyroidism, it doesn't mean that you can't lose weight with a proper diet plan and regular exercise, with changes in your lifestyle. You can certainly lose weight even if you're hypothyroid, and you don't have to worry about that. But on the other hand, you can't expect that all the weight loss will happen just because by treating the hypothyroidism.
Right. Dr. Pramila Kalra, what are the different types of thyroid swellings, and which ones need to be evaluated for surgery, and how would a layperson know?
Yeah, it is very important that any thyroid swelling which happens has to be doctor. So they need to consult the doctor if they develop any thyroid swelling. But the most important thing is, if there is a uniform enlargement, which is called as a diffuse swelling or a diffuse goiter, then that can be also associated with some of the thyroid function abnormalities, like patient may have untreated hypothyroidism or hyperthyroidism. But sometimes the patients may develop nodules, which are like rounded swellings, which may happen on the thyroid gland. So it may give an irregular feel. So these nodules may have a nodule, or there can be multiple nodules. So whenever a patient develops nodules, they need to be investigated by a proper imaging, which is the most common imaging. What we need to do initially is the ultrasound. So an ultrasound of the thyroid will give us a lot of information about the thyroid swelling. Along with the thyroid function test, as I told you, TSH, T4 and T3 needs to be done. And when we see that thyroid swelling on the ultrasound, we can decide whether this swelling needs further evaluation. So if the swelling is very small, less than 1 centimeter, and not showing any much problems on the ultrasound, sometimes we may decide to follow up that swelling with a repeat ultrasound at 3 to 6 months. But if there are swellings which are large, which are rapidly increasing in size, which have developed over a short period of time, or there is a scoring which we do on the ultrasound, which is called as TIRAD scoring, and it is showing some suspicion of cancer, then we might need to do some needle test of that swelling, which is called as fine needle aspiration cytology. This helps us to understand and know whether this swelling can cause any problems.
Right.
There can be some of these swellings will need to be operated if they are showing some malignancy or cancer changes, or if they are rapidly increasing in size, or if they are causing swallowing difficulty, voice change, any breathing difficulty, and it has developed over a short period of time. These are all the indications where the thyroid swellings may need surgical intervention.
All right.
So it has to be decided by the treating endocrinologist.
All right. Thank you very much indeed, doctors, for joining us on this thyroid special on health and wellness in Thyroid Awareness Month. And thank you for your very useful insights.